Hey everyone, it's Dr. Rakesh Sushil, and today we're talking about a condition that affects the heart's rhythm, heart block. Now, your heart has its own electrical system that keeps it beating in a regular, steady rhythm. But sometimes that system can have glitches, kind of like a misfire. That's where heart block comes in. It disrupts the electrical signals that control your heartbeat. The thing is, heart block can be silent and sneaky, or it can wave its red flags with noticeable symptoms. And those symptoms? Well, they can be as varied as the people experiencing them. That's why it's so important to understand what we're dealing with. We're going to dive into the common symptoms of heart block so you can be informed and proactive about your heart health, because knowledge, my friends, is power, especially when it comes to your health. So if you're ready to learn how to recognize the signs and when it's time to get help, stick around. We've got a lot to cover. Dizziness is one of those symptoms that can be really tricky. We've all felt lightheaded or a little off balance at some point, right? Maybe you stood up too quickly or you were dehydrated. But when it comes to heart block, dizziness can be a sign that your brain isn't getting enough oxygen-rich blood. Think about it like this. Your heart is like a powerful pump, and its job is to circulate blood throughout your body. If that pump isn't working efficiently because of heart block, the blood flow can slow down. And when your brain, the control center of your body, doesn't get the oxygen it needs, dizziness or lightheadedness can be the result, especially when you stand up after sitting or lying down. So if you're noticing this happening more often than not, it's definitely worth getting checked out. Chest pain is a symptom that should always be taken seriously. I know it can be scary, but it's crucial to pay attention to what your body is telling you. When we're talking about heart block, chest pain might feel like a pressure or tightness in your chest. It's not something you want to ignore. Here's why. Heart block can disrupt the normal rhythm of your heart, and that disruption can lead to discomfort or even pain in your chest. This is your body's way of saying, hey, something's not quite right here. Now, chest pain can be caused by a number of things, not just heart block. So it's important to get it checked out by a doctor to determine the underlying cause and get the right treatment. Shortness of breath or feeling like you can't quite catch your breath is another symptom that can be linked to heart block. Imagine your heart struggling to keep up with its workload because of the electrical signal disruptions. That struggle can impact your lungs' ability to get enough oxygen into your bloodstream. When your heart's rhythm is off, it can lead to fluid buildup in your lungs, making it harder to breathe. It's like trying to inflate a balloon that already has some air in it. It takes more effort. If you find yourself feeling breathless, especially when you're doing activities you could normally handle, don't brush it off. It's time to talk to a doctor and figure out what's going on. Heart palpitations can feel like your heart is fluttering, skipping a beat, or even racing in your chest. It's like your heart is doing a little dance it's not supposed to be doing. And let me tell you, it can be a pretty unsettling feeling. While occasional palpitations are usually harmless when they're caused by heart block, it's a different story. Heart block disrupts the electrical signals that regulate your heartbeat. These disruptions can lead to irregular heart rhythms, which we experience as those fluttery, skippy, or racing sensations. If you're frequently feeling palpitations, or if they're accompanied by other symptoms like dizziness or chest pain, it's important to get your heart checked out. We all experience fatigue from time to time, right? Life can be exhausting. But when we're talking about heart block, fatigue can be a sign that something's off with your heart's rhythm. Think of it this way. When your heart isn't beating effectively because of heart block, your body isn't getting the oxygen-rich blood it needs to function at its best. This can leave you feeling drained and wiped out, even if you haven't exerted yourself. It's like your body's battery is constantly running low on power. So if you're experiencing fatigue that's persistent and doesn't seem to improve with rest, it's worth talking to your doctor. Nausea, that feeling of wanting to throw up, isn't something you typically associate with your heart. It's more of a stomach thing, right? But believe it or not, nausea can sometimes be a symptom of heart block. Here's why. When your heart isn't pumping blood efficiently because of the disruptions caused by heart block, it can affect your digestive system too. Think of it like a domino effect. Poor blood flow to your digestive organs can lead to that queasy, nauseous feeling. Now, nausea is a common symptom and it can be caused by a whole bunch of things, from a simple stomach bug to more serious conditions. But if you're experiencing nausea alongside other symptoms like dizziness or chest pain, especially if they seem to come on suddenly, it's crucial to get medical attention right away. Exercise is usually a good thing, right? It keeps us healthy, strong, and feeling our best. But when you have heart block, exercising can become surprisingly difficult. You might find yourself getting tired much faster than usual, feeling short of breath, or even experiencing chest pain during physical activity. Here's the deal. When you exercise, your heart needs to work harder to supply your muscles with the oxygen they need. But if you have heart block, the electrical disruptions can prevent your heart from keeping up with the increased demand. It's like trying to run a marathon with a sprained ankle. It's just not going to happen smoothly. So, if you're noticing that you're suddenly struggling to exercise at your normal intensity level, or if you're experiencing unusual symptoms during or after physical activity, it's essential to talk to your doctor. So there you have it, a closer look at some of the common symptoms of heart block. Remember, your heart health is paramount, and knowing what to look out for is key. If you experience any of the symptoms we've discussed, whether it's dizziness, chest pain, shortness of breath, heart palpitations, fatigue, nausea, or difficulty exercising, please don't hesitate to reach out to your medical provider. It's always better to err on the side of caution when it comes to your heart. Early detection and treatment are crucial for managing heart block effectively. Your doctor can determine the underlying cause of your symptoms and recommend the best course of action, which might include medications or even a pacemaker to help regulate your heart rhythm. Remember, knowledge is power. By staying informed about your heart health, you're taking a proactive step towards a healthier, happier you. So listen to your body, be aware of the signs, and don't hesitate to seek medical advice when you need it. Take care of your heart and it will take care of you.